name is Alok Kumar, and today we talk about the anterior nasal packing. It is used in the epistaxis, and generally we can say in the nasal bleeding. So it is mainly used two types. First is gauze packing, and second one is the rapid rhino packing. So if primarily we go through the gauze packing. So in the gauze packing we need the gauze with the gelatin jelly and nasal speculum and why not forceps and ribbon with the petroleum jelly. So first of all we have to explain the patient the procedure. After that we have to take when the patient is agreed for the gauze packing. So in the process of the gauze packing, first of all we have to ask the patient which we have gauze. We have gauze with the anesthetic gelatin. So we have asked the patient to inhale the anesthetic, or so that's why it is so it is in that we use gauze to get localized anesthetic for the nose. After that we open the nose with the nasal speculum, and we use the ribbon with the petroleum jelly by the Bernard forceps, and we push it in the nose. So by we pushed from the anterior to the posterior fold by fold. After pushing that after pushing the ribbon which is dipped in the petroleum jelly, we have to ask to patient relax, and it is mainly generally we have it is used for the stop nasal bleeding. So we can use it to 1 to 5 days, depends on the patient, depends on the hemostating of the nasal bleeding. And the second procedure, which is we can say rapid rhino packing, and in this rapid rhino packing we have a rapid rhino balloon which is inflated. First of all we have to explain the patient the procedure, what we are going to do, and we need simple things. A rapid rhino kit which include the rapid rhino balloon and syringe and kidney. We need kidney tray and distilled water also, and we need some general NS just like gelatin jelly. So first of all we have to explain the patient procedure type. And when the patient get agree, we have to soak the rapid rhino balloon in the distilled water in the kidney tray. So when we soak the balloon till the 10 minutes. After that we take the patient on the we need a light, so we take the patient looking forward towards you, and her head is towards the upside. So we push the balloon into the nose of the patient very slowly and with the non-dominant hand. So it is little uncomfortable to the patient. You have to explain earlier to the patient and ask to stay calm. When we push the balloon to full balloon to the nose, we use the syringe and put the 10 ml air in the balloon. So the balloon get the air goes to the balloon, and it is stop the bleeding by forming the pressure on the bleeding vessels. And after that the pipes of the nasal balloon, we use the tape and take it side and use that, apply the tape to that's it become the in the side. So for removing this gauze packing, we just when the time when the blood is hemostat, when the blood stop, so we use the nasal speculum and take out the ribbon, just like I previously tell in the gauze packing. And in the rapid rhino packing, we have to just simple step, take the air out from the balloon with the help of syringe and take out the balloon. It is also rapid rhino packing is also used till 1 to 5 days. It depends on the hemostating of the patient and depends on the till nasal bleeding stopped. Thank you.